very pleased to have with us Louisa Grieg with us to talk about Galen myotherapy. Now, bear with me. This is a long intro. There's a lot to this. This lady has done a lot of things. Okay, so Louisa has been working with dogs in a professional capacity for over 15 years. She runs a busy consultancy practice covering Sussex, Surrey and parts of Berkshire, Kent, and has travelled as far afield as Essex, Hertfordshire, Norway and Estonia to treat and run workshops. So plenty of air miles, I think, there. She has experience in treating a variety of interesting and complex cases from dogs with chronic pain and postural issues, including those with existing underlying conditions such as osteoarthritis, hip dysplasia, spondylitis, and other orthopedic conditions. To those exhibiting more subtle postural performance, gait, and behavioural problems. She aims to provide an empathetic, caring, professional, comprehensive, and effective service supporting both you and your beloved dog. Louisa is also actively involved in the UK dry land sled dog scene. She is fully qualified as a BSc Equine Science and MSc Animal Manipulation Diploma Canine Myotherapy, insured and registered with both Galen Myotherapy and the International Association of Animal Therapists. We're almost there. I'm still going through this. She works to a robust code of conduct and always with veterinary consent. This is actually a legal requirement for therapists in the UK. She uses a combination of detailed case history, visual postural assessment, gait analysis, and hands-on palpation techniques to assess your dog, and works closely with you throughout the treatment process so that you are fully informed about what is going to happen during the treatment. Your expectations are discussed, feedback on your dog's issue is provided and clear, precise aftercare advice is given, and she will also liaise closely with any other professionals you and your dog are seeing to ensure a consistent team approach, which is how we met in the first place, which is always good. So, Louisa, after all that, absolutely lovely to see you. Love to see you in person, albeit through
Likewise.
because we've only discussed really things through either an email for our shared client or via Facebook chat. And I'm very pleased and very happy that you've invited me to shadow you at the end of the month too. Looking forward to that immensely. So I think the best thing to do here is for me to shut up and hand over to you to do all the important stuff. Welcome, Louisa.
Thank you for having me. So yeah, what an introduction. How can I elaborate on that, really? So just to give you a bit of sort of background on myself, way back when, as an 18-year-old, I actually wanted to be a vet. As it happens, didn't make it into vet school. So then I sort of took a slightly different route in that I did my degree in equine science at Hartbury College up in Gloucestershire. Really enjoyed the therapy modules, found myself very drawn to that side of things. And then I took about 18 months out from education just to do lots of different work experience, sort of figure out exactly what I wanted to do. Was very fortunate to shadow various professionals. Then I did my McTimoney qualification, so that was my master's in animal manipulation, which qualified me as a McTimoney animal therapist, which is essentially very gentle chiropractic style techniques. We're not going to go too much into that tonight because this is about myotherapy, but just to give you a bit of an idea of how I eventually qualified as a Galen myotherapist. So I was practicing for probably about a year before I found Galen myotherapy, and I just felt, for me, that I needed more. I needed to be able to offer a more comprehensive treatment. For me, treating the skeletal system was sort of the tip of the iceberg. So I just did a Google search, realised that Galen myotherapy was exactly what I was looking for. Lucky enough, the office at the time was literally 10 minutes down the road from me. And I sort of went from there. Prior to qualifying as a Galen myotherapist, I'd been treating horses as well, the McTimoney qualification qualified me on both dogs and horses, but I just found myself leaning more towards the canine side. I was lucky enough to do work experience with one of the leading canine hydrotherapy centres, and later found myself working there full-time while I was training in Galen Myotherapy, and that really sort of put me on the track of, yes, dogs is where I want to go. This is my calling. And that was that, really. So I've been qualified for about 10 years now. I don't know where that's gone. And yeah, as Mark said, my caseload is really varied. So I actually started treating agility dogs, and now I work with several flyball teams. Obviously the sled dogs are a massive sort of passion of mine, so treat lots of furries, right through to your sort of middle-aged and senior dogs that are struggling with sort of mobility issues, arthritis, chronic musculoskeletal pain. So it's really sort of across the board. So that's it, really.
Wonderful. So you've done a lot.
Yeah,
you really have done a lot
when
in a relatively short space of time. You've packed a lot of life into those years, haven't you? And I imagine that the sled dog stuff is probably you probably get quite a lot of work out of that due to just injuries of, stress and that kind of stuff with them pulling things about the place, I'd imagine.
You'd be surprised. I don't see that many that have had injuries. I think injuries actually, while they are taking part in the sport, are quite rare. Yeah, it's more, I would say, sort of maintenance that I see them for, or sort of those with a few miles on the clock where they might just start to need a little bit of work. I do a lot with warm-ups and warm downs and trying to implement that, but of course with your kind of sled dogs, a lot of mushers have a team of dogs, so it's very different dynamic to having kind of your one agility dog. So it's trying to sort of work in those practices into a way that's going to work for that dynamic. Yeah.
Well, so it's certainly a full life that you're leading at the moment.
Yeah, it's
busy. Well, I know you've got some slides that you wanted to share with us.
Yes.
Start those and you can talk your way through them.
Yeah, sounds great.
Okay, one second, just my dog barking in the background.
Always happens.
I shall mute me in a minute. It's because the cat came in and she doesn't like the cats. So it's okay. Right, let me just share this. Let's have a little look. Right, can we all?
Lovely. Brilliant. Oh, I also left out something else I've done. I'm also a Reiki practitioner as well. I've only done my first degree. I'm planning to do my second degree and the third qualification, which is Reiki Masters. So I tend to use that as a lead-in to myotherapy. It works beautifully with nervous dogs if they're a little bit unsure, because you can use it at a distance. So it means that I'm not crossing their threshold of what they're comfortable with. And I can just get them really comfortable with me. So that's something I integrate into my treatments as well. Yeah, so I think we can go to the next slide. Okay, so I think we've covered most of this, but I need to show you these gorgeous guys. So these are some of the dogs that I'm very lucky to have in my life. So we've got Luxie, top left, who is a Greenland dog. And then below him, we've got Ava, who's his sister. Top right, we've got my Alaskan Malamute Fury, who's sadly no longer with us, but she's my absolute soulmate little lioness. So that was taken out in Italy, funnily enough, at a dryland sled dog championships. And then we've got the Peskies, as I call them, Invi and Ira, who are Canadian Eskimo dogs. So Eskies, Peskies, they are half brother and sister. They're both retired now. They are 8 and 10. So yeah, couldn't resist a chance to get their photos in there.
No, well, they're all gorgeous. And a friend of mine who does sled dog stuff has also got a Greenland.
Is that Wolvie?
You know him, don't you?
Yeah, so Ava is Wolvie's mummy.
Oh, wow.
Yes.
Wow, small world.
Yeah.
If you're watching, hi, Kim.
Hi.
Yeah, gorgeous, gorgeous dogs. All right, I'm going to mute myself and let you carry on.
We could chat all evening. Okay, we can go to the next slide actually, Mark. Thanks. Okay, so here's a bit more about what I've been up to. So as Mark said, I've been really fortunate to be able to work out in Norway and Estonia with one of our Galen contacts. As I mentioned, the sled dog events, I've been lucky enough to go to Italy, Germany. I know that Galen are planning to go out to India. They went out in 2017. I didn't go to that trip, but we've got an amazing colleague, Sindor, who is also a behaviourist. She's also a qualified Galen myotherapist, and she does a lot of observational study of street dogs out in India. And we also do treatments. So that's super, super exciting. Yeah, I mean, although this career is fairly niche, I would say, people always say to me, is that a thing? Do people have physios for dogs? There's so much scope to take it wherever you want. You know, you can specialize in rehab, osteoarthritis clinics, numerous sporting disciplines, attaching to vet clinics, hydrotherapists, behaviorists. I really enjoy working with behaviorists in particular. Mark didn't pay me to say that, because it just works so well. Where there's an element of musculoskeletal pain or any pain, it just is so intrinsically linked with behavior. I will say though that myotherapist, we're not a substitute for vets, so the dog should always get checked out initially, but I think that being done, it can just work really well, because I hope Mark agrees that you're not going to get a kind of meaningful change to behaviour while there's pain present. So we need to work together, and I think that's a really good example of how collaborating as a team can work. So there's massive scope for continued personal and professional growth. So there are so many courses out there in whichever kind of subject you're interested in. So for example, I'm doing a weekend course on myofascial release techniques in a couple of weeks. But it's a real passion. It's absolutely not a job. It's a passion, and massively fulfilling.
I imagine it's very rewarding when you see that going
Hugely.
through. Just jumping back to the vet check, it's something that any good behaviorist will not work on a dog unless they've been seen by a vet in the first place to rule out medical pain issues. It depends on some of the issues you see, but more often than not, it is a pain issue. And you can solve that a little bit easier with perhaps coming to you via a vet, and those kind of things really do help with dogs. But I love working with people. You know, I love working with different professionals, you know, and not only just behaviorists and trainers, but also other professionals as well that are linked into it. Because I think now, if you find the right people, then we are a great team at that point, aren't we? And I think all of that just a minute ago hopefully has answered Young's Dog Training LLC, who asked, "What is this about?" So hopefully, if that's answered your question, do let us know. And if it hasn't, if you want to expand that question, then I can obviously ask Louisa for you as well. So back to you, Louisa.
Brilliant, thank you. So if we go to the next slide, we'll get on to what myotherapy actually is. Okay, so essentially it's massage based. The technique is massage based, albeit it's more akin to human sports massage as opposed to sort of going for a relaxing aromatherapy style massage, in that it's, we look at function, we look at the dog as a whole interconnected structure. So for example, if I had a dog that was presenting with an issue in one area, and what I mean by presenting is they might have a lameness in one area, or they might look stiff in one area, I won't, or Galen myotherapist won't just treat that area. We'll look at, okay, is there a cause to that elsewhere in the dog's body, and what is the knock-on effect of that? So we look at patterns of chronic overloading, compensation. We look at the kind of chains of compensation. We look at the biomechanics. There are lots of different aspects that tie into it, but the nuts and bolts of it are, it's a massage based treatment. We also use range of movement techniques, myofascial release, trigger point release, that kind of thing, but it's manual techniques that work on the muscle. So myo muscle therapy speaks for itself. So we specialize in treating chronic muscular pain. What I mean by chronic is, I would say the vast majority of dogs that we see, these muscular issues, this pain and tension have been there for months, if not years. And then there's been a cumulative effect whereby it's snowballed to the point where the dog's finding it difficult to disguise the pain, which is where we get those overt signs coming to the fore. I would say one of the leading sort of causes of these issues are repetitive strain due to either the environments they live in. They essentially live in our environments, it's man-made, and we'll come on to that more, and incorrect activity or exercise. And as I say, we're going to discuss that in a little bit more detail later on. So Galen myotherapy have 6 guiding principles. So this is what Galen myotherapists stand for. So choice-led treatment is absolutely imperative. We never restrain, we never muzzle, we treat dogs at floor level. The reason being is, I'm going to use the analogy, if you go for a sports massage, imagine if your therapist held you down, didn't seem to realize that you were in pain, just carried on regardless. If you tried to vocalize that, you were told off for being naughty. That would be terrifying, right? Whereas if we flipped it and the therapist was very in tune with how you're feeling, empathetic, gave you breaks, read your body language, adjusted their pressure of what they were doing, checked in with you, you'd feel completely different. So choice is so important, and dogs really understand. I often find that sometimes owners can feel almost a little bit embarrassed, you know, they're being naughty or they're wasting the therapist's time, and it's a real switch in perception to actually, this is really important, let them go and sniff. They need to self-regulate and just take 5. So that is absolutely massive. And it's usually quite emotional when you've had a dog that's a bit nervous and they have that light bulb moment and they go, oh, and then they will actually offer you their painful area. I think I can speak for pretty much the whole myotherapy team that there are often tears in the appointment from the owner and us, because it's just so profound. You don't need to restrain them. You just have to build those foundations with time, patience, reading their body language. And I think point 6 is knowledge of body language. I mean, it's so important. Behavioral understanding. So it's really important that we can read those really subtle cues that dogs give us. They won't necessarily move away if they're uncomfortable. Some dogs will freeze and start to shut down, and it can be as subtle as a slight clamping of their jaw shut, or a very slight change in their gaze, or they just go a bit more still, or they can go into what we think is kind of silly behavior, like, oh, I'm going to roll on my back and give me a cuddle. And actually they're saying, I'm a bit nervous about this. So it's really important. It's crucial that we read the dogs accurately and respond to it appropriately. So owner empowerment, what do we mean by that? So that can come in all sorts of forms. So helping owners recognize the subtle signs of chronic discomfort so that they can monitor their dogs effectively, whether that be booking in a treatment for them, or going to the vet to adjust their pain relief, or making changes in the home environment. So we're absolutely here to support owners as well as dogs through education, through providing tips. We will advise on exercise, the home environment, as I say, signs of pain, kind of behaviours associated with that. We can show owners how to apply basic massage techniques at home to just help treat the dog between their sort of professional treatments. So there's a lot of owner support that goes on there. And I just want to add to that, Mark and I were having a bit of discussion kind of off air, if you like, about sort of owner mindset around their dogs being in pain. And some owners can feel quite almost embarrassed or worried. So I think the emotional support to the client and being that approachable, non-judgmental professional and having that human touch is really important. So high level of specialist knowledge and training. All our myotherapists will have undergone the Galen Myotherapy diploma, which I believe is a level 3 qualification. It's been a long time since I've done it. Many of us have gone on to do other courses, other qualifications. I know we've got some vet physios. I don't think we've got another McTimoney therapist, but lots of us have kind of various specialist areas. Sharing of knowledge. This goes for, it kind of ties into the owner empowerment, but also with other professionals as well. I'm always really keen to learn from other professionals, and likewise, with kind of the newly qualified Galen therapists that are coming up, I'm really passionate about helping to support them, because I've been there and it's only going to benefit the dogs and the owners. So I think that's really important. We really are sort of a little Galen family where we all support each other, which is really lovely. CPD, continuing professional development. Not only does that keep our skills and knowledge current, but it's a requirement to remain a member of Galen Myotherapy, and IAT as well. Most, if not all, professional bodies will stipulate so many hours of CPD per year. Yeah, I think that's that slide done.
Yeah, we do the same thing at Into Dogs. That you have to do, as a behaviourist, you have to do 40 hours a year of CPD.
Yeah.
Model that. It needs to be a varied CPD. So yes, you can read some stuff, you can see some webinars, maybe some courses. It needs to be a big mixture, but you're quite right. And any good professional is going to want to update their professional knowledge on a regular basis. It's just common sense, isn't it?
Yeah, completely. And there's so much to learn. I don't think you ever stop learning. You're kind of a lifelong student.
Yeah, it's well, it comes down to that imposter syndrome thing. You know, the more you learn about something, the more you know nothing at all really at that point. You know, it's just you're kind of astounded that there's so much more out there that you need to learn to help more and more and more.
Yes.
So you're quite right. Yeah, lifelong students.
Definitely. Okay, so this is just a little bit about my training in particular that Mark discussed at the beginning. We've mentioned CPD. All Galen Myotherapists are fully insured, so we have professional indemnity and public liability insurance. So just a bit of a side note, if you're an owner watching this, if you are looking for a therapist, not necessarily a Galen myotherapist, but do check what their qualifications are, do check that they have the appropriate insurance. Legally, we have to get vet consent from the animal's vet before we can see them, so we don't need a referral or recommendation from the vet as such, but we do need the consent, the remit of which is to state that the animal is medically fit for treatment, i.e. the dog doesn't have a condition whereby the treatment would be inappropriate or unsafe or going to worsen what's going on. So for example, if I had a dog come in non-weight bearing lame, there's no way I would touch that without it seeing the vet, because there's very, very, very likely something going on there that needs vet treatment as opposed to myotherapy at that stage. We have a strict code of conduct regarding our professionalism, our treatment protocol, our client and vet communication. So things like discussing expectations with the client, outlining what to expect, reporting back to the vet. Again, Mark and I were having a bit of a chat about the difficulties of assessing chronic pain. And this is where we can act as a really helpful information source to vets, because we do get to gather a lot of information that maybe isn't accessible to a vet within a sort of 10-15 minute consultation. So again, it's that teamwork. We obviously have to keep records. We mentioned the way that we handle dogs. We absolutely don't restrain, we don't muzzle, and we let them take breaks and move away from the treatment area. So that is imperative. Yeah, I think we've covered everything on there. Okay, so general benefits of canine massage. Why is massage helpful? So without going into the technicalities and the specifics of kind of myotherapy in terms of posture and gait, let's just sort of start with the basics. Okay, so it positively influences the lymphatic and circulatory systems to enhance blood flow and lymphatic drainage, which assists in healing. So by manually, I use the word manipulating the muscles, which I always think sounds a bit severe, but by manually manipulating the muscle, you're helping to move blood around the body, which is going to be important for your oxygen and nutrient delivery to cells. Lymphatic drainage, so the lymphatic system is like the secondary sort of waste disposal system of the body. Now it's stimulated by movement, but also massage can assist with that. So that can be particularly important. If you've got a dog whereby their mobility is severely compromised, then that will then have a knock-on effect potentially on their lymphatic drainage, because they're not getting that movement that moves the lymph around the body. We know that massage has been long documented as having a pain relieving effect due to the production of natural opiates, endorphins, and various other hormones. I don't know if any of you have ever had a massage, but you come out feeling like, yeah, everything's great. So it's wonderfly relaxing. It stimulates the parasympathetic nervous system, which is your rest and digest. So it's wonderful on a psychological level as well. Yeah, so we've just said there it promotes relaxation. So in terms of treating a dog, it can be really nice for them as well. So when you're in pain, you kind of feel mentally tense, don't you? You're like, right, I've got to cope with this. So just being able to give them that sort of mental break as well. I treat a lot of dogs that might be feeling anxious because either because of their backgrounds or the pain they're in, lots of sort of high drive working dogs. And it's actually really lovely to be able to just give them that break. So massage relieves muscle spasm, cramps, adhesions and tensions. It helps to rectify muscular and fascial dysfunction. So muscular dysfunction, typically when we talk about tight muscles, what we mean is they've shortened. So effectively we're lengthening them out, among other things, and we'll discuss kind of how that relates to range of movement and posture a little bit later. The fascia, for those of you that aren't aware, fascia is it's gaining a lot of attention, quite rightfully recently. I think previously in sort of vet dissections it was just, let's get this stuff out of the way so we can get to the muscles, but it's actually an amazing organ. So it's connective tissue that runs between the skin and the muscles, and also sort of envelops the muscles. So it's this network of really strong tissue that sort of keeps pockets of muscle in place. It's when you get fascial dysfunction, it's a little bit like wearing a jacket that's a couple of sizes too small, so everything kind of shortens, and it has a profoundly sort of restrictive action on sort of range of movement. So you can see how kind of if we've got fascial dysfunction, then that's going to have an impact on posture. It has nerves running through it as well, so if you've got tight fascia, it can be super painful. So it's actually a really important organ to look at. So as opposed to sort of going for your sort of relaxing massage, which tends to work on a more superficial level, myotherapy works on sort of a deeper level. So we're really looking to get into the nitty-gritty of kind of what's been going on for a long time to correct postural, overloading, adaptive and compensatory problems. So typically we'd see a dog sort of 3 or 4 times over sort of a 3 or 4 week period to really get in and sort of unwind what's going on. Massage is also such a wonderful tool for building the trust and connection between you and your dog. It's really quite magical. I've taught lots of owners to apply massage, and you can just see them beaming when their dog responds, and the dog kind of goes, oh, that feels amazing. So yeah, it's really, really lovely. And also it's lovely for owners to be able to do something practical and tangible that helps their dog feel better.
I was just literally about to ask you whether you gave guardians of dogs something that they could do whilst you were there to help along, and you've answered me before I could answer the question. But yeah, it must be really good for the guardian to see that.
Yeah, and it's really empowering. I've got a beautiful Alaskan Malamute and her mum that I'm working with. They live nowhere near me, so we've been working remotely and we've been doing Zoom calls, and I've been helping her apply some basic massage. The dog won't let her near her back legs yet, which is fine, but she messaged me and she said, oh my goodness, she is so much better just from what I've done. And I said, is that just from working the neck? And she said, yeah. And I was like, well, there you go. It's really powerful. And it's because I think owners can feel quite sort of worried and helpless, like, oh, my dog's going downhill and I don't know what to do. So it can be really powerful.
And of course, it's a wonderful bonding experience between the two, because at a certain point the dog is going to start to trust that the guardian is trying to help them, and you get that moment of trust. Oh, blows you away.
It does. It's really emotional. I remember when I started treating Envy, who's the white Canadian Eskimo dog, I had to do Reiki with him for an hour before he let me touch him. And now, sort of years down the line, he's like, actually, I quite like this. And it's wonderful. It's really wonderful.
Maybe he just liked the Reiki and it was just stringing you along for all that time going, oh, I've got a bit of Reiki.
He was like, do more of that. Yeah.
Okay, do you want the next one?
Yes, please. That would be great.
Here we go.
Okay, so let's get more into the specifics of Galen myotherapy. So it's based on the Swedish style of massage. It's a specialized form of massage that was exclusively adapted to treat dogs by Julia Robertson, who founded Galen myotherapy, I think in 2002. She will kill me if I get that wrong. So the way that Galen myotherapy came about was Julia has a farming background. She was also a vet nurse for many, many years. And she had a dog whereby she took him to the vet because he couldn't lift his head up. And there was something, she thought, oh, there's something seriously wrong here. I believe the vet advised PTS. She then got a second opinion from another vet who said, he's got a tight neck. And she had this kind of light bulb moment of, wow, how many dogs are suffering with muscular issues? And that was that. As I briefly mentioned earlier, the sort of core of what we do is based on massage, but we also use various other soft tissue and joint mobilization techniques, range of movement, stretching, functional exercises, which are very subtle movements that we use to promote muscle engagement, almost kind of retraining the way that the dog uses their bodies and moves to complement the manual work we've done. So kind of phase one is the treatment, and then phase two is sort of building that muscle strength and sort of retraining that muscle patterning, so the dog's moving in the correct way, they're engaging the right muscles, which helps to sort of prevent them reverting to those compensatory movement patterns. So as part of what we do, we will look at the dog's posture, we will look at, their gait, i.e. the way they move. So the way that I work, and I believe that other myotherapists are similar, is before I even see a dog, I will ask the owner for specific pictures and videos. One of them is their dog doing a poo, which they always think is really weird. But the reason for doing that is you can get so much information about the dog's posture, the way they load their bodies, where their pain is, through that. So it just means that I've got so much information before I've even seen the dog. And also the client isn't spending money on a consultation for the first session. We can get straight in, I can get to know the dog and start working with them. I will also ask the client to complete a questionnaire which relates to more subtle signs of chronic discomfort. That's a really helpful tool for many reasons. It kind of gets the client thinking in a different way in regards kind of, is my dog in discomfort, or how do they actually show it? So it's building that awareness. Second, we can use it as our sort of baseline, not only to assess the effects of the treatment, but any other modality we might want to implement. So for example, if I don't think a dog's pain is being adequately controlled, it might be that I say, okay, it might be worth going back to the vet for a pain medication trial. So we can use that as our kind of marker for change. So we will use a holistic function-based approach, which looks at the dog's entire body. We treat the cause as well as the secondary effects of the issue, not just the issue itself. We will also look to advise on the home environment, exercise, whether any other therapies might be appropriate, and management, because the myotherapy treatment is wonderfully effective, but if the dog's doing something on a daily basis that's kind of aggravating their issue, whether it be moving over a slippery floor or being over exercised, you're just firefighting. So you really need to look at the whole picture to be as effective as you can. The body's very good at adapting to and disguising muscle pain, which is how these kind of long-term compensations build up. It's just those layers and layers of kind of adaptation. We treat, as I say, we specialise in chronic or long-term issues, lameness, dogs with pre-existing conditions, so your hip, elbow dysplasia, spondylosis, old injuries, sports performance, rehab, so that there's quite a lot of areas that we get involved in. Okay, next slide. Okay, so I think we've kind of covered this, but we can make these slides available. Would that be possible on your page?
Well, I'm sure we can. I'm sure we can put it up for people if you don't mind them being shared. Of course, it's not.
Yeah, no, that's fine. This is just kind of a bit of extra reading more than anything. It just kind of discussing some of the physiology about. Of how massage promotes relaxation. I mean, massage has been around. It's an ancient therapy. It's long been known to promote relaxation in the body. Someone's
just popped up and said yes, please. So
yeah,
we will make those available. And don't forget, we're also going to make available, as we already have, links to Louisa's page and Facebook things and all that kind of stuff. So if you need to ask a question or get in touch to get some work done, by all means, please just contact her direct.
Thank you.
Okay, so do you want to skip past this one and go?
Yeah, let's skip this one because we've got quite a lot to go into. Yeah, so via the muscular system, massage actually influences all of the body's systems, so the endocrine system, the cardiovascular system, the lymphatic system, we mentioned the respiratory system. So by manually working the muscles, you're effectively not just moving the muscle tissue itself around, but you're moving blood around, you're moving lymph around. You need that mobility on a cellular level to maintain good health. We know that in terms of range of movement, kind of lack of movement can kind of, we've all heard the phrase kind of seizing up, so we need that movement, and we can sort of simulate that by doing kind of stretches, taking the joints through their range of movement. Neural pathways as well, so it's very sort of holistic. Although we might be treating a musculoskeletal issue primarily, we can often find that kind of other issues can sort of be improved almost as a side effect. Okay, next slide. Okay, I think we've covered most of this, but as I say, we can leave these up. So this is an important point to note. So say, for example, I'm treating a dog with hip dysplasia. I'm not going to be able to affect the hip dysplasia itself, but what we do is manage the secondary muscular compensations of that primary disease or condition, if you like. So typically what will happen is you'll have the pain associated with the primary condition, and then you'll have additional muscular pain due to those compensations. So of course we can advise on how to help manage the hip dysplasia, for example, but by sort of reducing and minimizing those compensations as much as we can massively sort of minimize that dog's pain. And then of course you've got the lifestyle advice, the exercise advice. So quite often you can find that the secondary muscular effects of a condition cause the dog as much, if not more, pain than the primary condition. So we treat areas essentially of excess loading. So if we stick with the hip dysplasia example for the minute, what can typically sort of start to happen is, for those of you that don't know, hip dysplasia in very, very broad terms is where the ball and socket joint of the hip don't fit together perfectly. And there's various sort of permutations of that. So typically in areas of pain, the muscular system's response to that, to limit pain in that area, is to shorten the muscles around it. So it's a protective response. So what can happen is the hip flexors can get really tight, which are the inner thigh muscles. So that has the effect of kind of drawing the thigh bone sort of into the body more. So you're closing the angle between the hip joint and that thigh, which in the short term, great, less pain. But then what happens is the lower back starts overworking and kind of locking up to in response to that. So then, as well as potentially hip pain, we've now got lower back pain. So then what can happen is the dog goes, okay, I'm just going to shift my posture so that I'm bearing a little bit more weight on the forelimbs. So then that kind of offloads that back pain. But over time, you're going to get overworking of the forelimbs, the shoulders. It's quite common to see older dogs where they have this kind of skinny little butt and massive shoulders, massive neck, where that's been overworking for so long. When you work a muscle, it gets bigger, right? And they're so overdeveloped and tight. So it may be that that dog then starts presenting with a forelimb lameness, which is the result, or the sort of end result of a long time of overloading. Does that make sense?
Absolutely.
So that's a bit of a sort of case study. If we stick with the case study, so in a dog like that, I would potentially advise on perhaps a joint supplement, appropriate exercise, home environment adaptations to prevent repetitive strain injury that's just going to keep aggravating that. So it's kind of all these pieces of the puzzle that need to come together to provide the optimum outcome. Yeah, I think I've covered that slide. Should we go to the next one?
Yeah, sure.
Okay, yeah, so I've kind of discussed this. So how do we actually improve muscle function? So we're effectively kind of easing congestion in the tissues, restriction through the muscle shortening. Muscle fibers can become adhered to each other. We mentioned the fascia earlier, that can get sort of stuck down, which of course is very restrictive. So by using these various techniques, what it's all about is promoting muscle function, improving muscle function, and in doing so you're going to improve the quality of their movement, their range of movement, their posture, the pain perception, the mobility. So what we mean by muscle inhibition is when muscles shorten. So if you imagine your joint, and you've got the muscle spanning the joint, if that shortens, it's going to close the angle of that joint. So then it's going to become slightly less functional. And then what happens is, if you have an area that's sort of underworking or restricted in mobility, an adjacent area can tend to overwork. Then when that starts getting sore, again, this layer of adaptation builds up over time. So I've given a bit of an engineering analogy below. For those of you that are sort of technically minded, a really important point to make is postural adaptations are a direct representation of how the dog feels in their body. So we hear this a lot, oh, that's normal for them, or they're lame but they're not in pain. But I would argue that any sort of adaptation away from that sort of typical 4 square posture is due to pain and the dog trying to adapt and accommodate that pain and make themselves more comfortable. Sometimes these signs can be really, really subtle, but it's really important to get a dog checked at that point, so that those issues don't go away on their own. They just kind of snowball.
Yeah.
Okay.
I've got
I'm really
got a quick question here from you. The person that's asked the question, I apologize if I pronounce your name wrong, I really do, but it's either Bigi or Biggie. They've said that they are a canine behavior consultant and training as a TCVM practitioner. Would that be a good combination with Galen myotherapy?
Forgive my ignorance, but I don't know what the second one is.
No, I don't. Could you just put a comment up to explain what TCVM is for us, and I'm sure Louisa will be able to answer that question for you. So
is it traditional Chinese veterinary medicine?
If it is, and that was a guess, that's a good guess. But we will find out very soon, because I'm now interested.
Yeah, me too. I want to know.
This sounds fascinating to me. Yes, I would look at that. Traditional Chinese veterinary medicine, or medinizer. It's got here, medinizer. But yes, you're pretty much on spot on there.
Yeah, absolutely. I mean, my approach is very holistic. I mean, you probably guessed from incorporating the timony and the rake. I mean, dogs and humans, we don't work as kind of isolated units. We work as interconnected structures. We know that emotions and the mind influences physiology. So I think anything that's safe and looks at the dog in a holistic way and in an integrated way, I think that could dovetail really nicely. So yeah, absolutely.
That's answered that question. That was a great guess, by the way, of what that was going to be called. I'm very impressed. That was great. Did you want the next slide? Sorry.
Yeah, please. I'm conscious that I'm talking a lot and we've got like 7 minutes.
It's all good. These things always go over a little bit, so don't go back too much.
So this is just a slide just kind of highlighting that massage and manual therapies are now being recognized in scientific literature as being effective for treating muscle pain and effectively reducing muscle pain. I think with kind of therapeutic modalities, they can be quite difficult to prove scientifically, because the very nature of them doesn't typically fit within the model of a robust scientific study, so kind of the standardization, all that kind of thing. But nevertheless, the science is there, which is really important for sort of integrating myotherapy and massage therapies into sort of mainstream vet awareness, and something that kind of vets will refer animals for, hopefully more in the future.
Cool. Okie dokie. So we're on slide 12.
Of like 30.
We'll have to get you back for a part 2, you know. We did that in 6 weeks and do a part 2.
We might have to.
It's far too interesting.
It is. I mean, I think sometimes the difficulty can be making the subject concise, because there's so much of it. So contraindications to massage, these are really important. So what they mean is situations or conditions whereby massage is not appropriate or safe, because it could worsen your dog's condition or be painful for them. So going back to the vet consent, this is exactly why we get vet consent, because we want to make sure that treatment is appropriate for that dog. So no vet consent is a contraindication. Fever, virus or infection, A, because the dog is going to feel rubbish, but B, remember with massage you're moving things around the body, so we don't want to be moving infection around the body, either systemically or via the skin. Also, we don't want to be an infection risk for the next dogs we see that day, so we need to make sure that we are protecting the other dogs we see. Open wounds, pretty self-explanatory. cancer can be what we call a relative contraindication. So you have what we call absolute contraindications, which mean under no circumstances should you treat that dog. You can have relative contraindications, which mean it may be possible to treat that dog as long as you've liaised with the vet, but you may want to modify your approach. So it may mean you might want to avoid a specific area, you may want to sort of go more lightly, but also look at the dogs, see what they want. I've had a few dogs where they've been fine with myotherapy previously, but on that day they didn't want it and they just wanted Reiki. So use the dog as your guide, they will tell you. Cancer, as far as I'm aware, there's no scientific literature that has proven that massage moves cancer cells around the body. However, remember that we were talking about massage moving lymph fluid around the body. So theoretically, there could be a risk of spreading that. I have treated dogs with cancer whereby it's been very advanced. So in those circumstances, that the sort of relative risks are almost a little bit of a moot point when weighed up against the benefits to the dog's well-being by having massage. I mean, in these cases, I wouldn't be looking to do a deep myotherapy treatment. It would be perhaps working on their key areas of tension to provide a bit of relief, maybe doing a bit more of a sort of general all over body massage, a light massage, more of a kind of well-being treatment. Certain heart conditions, clinical shock, the reason being you don't want to be moving blood around the body with massage and away from the vital organs. So super dangerous. I don't know why your first instinct would be to massage a dog if they were in clinical shock anyway. Suspected fracture or break, you could displace that, so that would be straight to the vet. Undiagnosed lameness, I've actually had a couple of dogs that came in to see me. I wasn't aware that the dog was so lame. Hopefully that's now filtered out by asking the clients for videos, or I think they'd been lame at the time of booking and then got a lot worse. So through sort of careful questioning, I was able to ascertain the dog hadn't seen the vet for this level of lameness. In both those dogs, actually, it turned out that they had ruptured a cruciate. So it's really important to know what's outside of your remit as well as what's in your remit. Just before eating or exercise, or within 3 to 4 days of any other therapy. So basically, you don't want the body to be dealing with anything else or processing anything else while they're having a treatment, and you need the body to be in balance or to be in homeostasis. Also, if your dog doesn't want to be treated, we never ever force a dog to be treated. As I say, it's completely choice-based. So those are kind of the main ones. There are others, but they're the biggies.
Cool.
Okay, so there is crossover between physiotherapy and myotherapy. I've included this because it's something that we get asked a lot. Physiotherapy, I would say, uses a larger variety of therapeutic skills and devices to treat conditions. Typically, Galen myotherapists specialize in more sort of chronic cases, so your long-term compensatory and postural issues, whereas physiotherapy, they do that, but their kind of expertise, I would say, perhaps lies more in the acute cases, so acute post-rehab cases. Physio and myotherapy can work really well together. They don't have to be sort of mutually exclusive. I've got an amazing physio that I work with for what I call my technical cases, where I've gone, okay, I feel like I've done as much as I can, I've improved the condition, but there's something else going on here that's outside of my remit, so it can work really well. Yeah, then there's a little paragraph below about the way that kind of chronic pain is perceived by the body. So essentially, unlike acute pain, which serves a protective purpose. So I don't know, you touch a hob and you go, ow, so that you don't get that tissue damage. In chronic pain, you get this kind of wind up of sensitivity. So the central nervous system actually perceives pain differently, meaning that the level of perception becomes what's that word, disproportionate to the actual amount of pain. So it is different with chronic pain. Dogs experience it differently. Okay, let's go to the next one.
You're flying through now. Look.
Okay, so I'm just going to sort of call out a few points in regards posture, just really quickly. So this dog, he's quite an old border collie. So for me, his neck and shoulders are really overdeveloped. So to me, that suggests long-term front loading, or front wheel drive as I call it. The back end looks quite weak. He's bunny hopping, meaning he's moving both hind legs together. There's not much flexion in the top line. His neck looks really short. He looks quite sort of pained in the face. For me, there's a lot of tension around the jaw and the eyes. There isn't really much length or extension at all in the neck. He's doing what I call turtleneck, where he's kind of retracted into the shoulders. So for me, I would be looking to treat that long-term overloading and pain in the front, ease the neck, the shoulders, and then after that, perhaps look at okay, what's caused this onset of weakness or maybe that's the wrong way to phrase it. It might be that this dog has got an underlying condition such as osteoarthritis in the hips. So we need to treat the pain, whether that's with myotherapy. We don't know if this dog's on any pain relief. Ideally, I'd like to implement some exercises to sort of improve or retain what strength the dog has in their back legs. So it's a very, you've got multiple aims when you're treating a dog. So for example, if I were to treat this dog and just look at the front end, I'm not going to be looking at what's kind of perpetuating that. Okay, so let's go to the next one.
Oh, wow.
Yes, so this little lady, just has so much going on. Yeah, let's go to the next slide and it actually explains what's happening. So this poor little one, she actually had a stifle and knee issue. So then what happened was she shifted the load up to her hips. So you can see that she's quite straight through her knees. She almost looks like she's on high heels, where the top of her pelvis is higher than the point of her withers, like the top of the shoulders. So she effectively looks like she's tipping forward. So you're getting this huge overloading of the forelimbs, the shoulders, the neck. She actually can't lift her head up very much. Her facial expression I think she looks quite depressed. Her tail's clamped down. There's just so much going on. So then the next slide is her after 3 treatments.
Oh, wow.
It's so different, so different. She just looks more balanced. The top of the pelvis is almost level with the withers, the top of the shoulders, the tail's free. I mean, she's still quite straight through her knees, but that whole posture in the hind limbs is so much better. There's more length in her body. She's not tipping forward. Her kind of chest isn't so far in front of her front feet as it was. She's able to get her neck and head carriage higher. Her eyes look bright. So, I mean, that's a really striking example, but this is how profound these long-term postural issues can be in terms of dogs' posture.
Can I just skip back to that first picture?
Yeah.
And just to see
I should have put them side by side.
I mean, it's the difference. It's almost like she's almost shunted into a wall and crunched up
Yeah.
And then you get the after. I mean, it's just such a difference already. If that's just 3 sessions, it's amazing.
Yeah. And the thing is, when you put them side by side, it's really obvious. But when these changes happen over time, you just don't see it, or kind of you don't realize kind of how bad the dog's got.
Wow.
Yeah, so this poor little retriever, he can't even hold his head up. So he had a neck issue. He has tried to accommodate the excess loading on his forelimbs and shoulders by increasing the distance between his front paws, and he's rotating the front paws out. He's almost like in a tripod position where his left hip and left back foot are kind of in the middle between those forelimbs. And again, he's got tension in his mouth, his eyes. He just looks really unhappy, bless him.
Wow.
And then if we skip to the next one, so different. I mean, he's still kind of like got a bit of a triangle going on, but his back left is more in line with the front left. His neck, he's actually able to hold his head up. The facial tension has kind of gone. I mean, I know he's looking up at an owner, so that is a snapshot in time, but it's, if we can't get a dog kind of completely what am I trying to say, it's improving the dog in terms of their comfort levels, posture, movement as much as we can within their condition and maintaining them there. So yeah, it's quite different, isn't it?
Well, I know that he's looking at his guardian there, but he just looks so much happier.
Yeah, doesn't he?
At that point, you know.
So different, so different. Yeah, so this is just kind of an infographic to illustrate what I was trying to explain about the way that pain sort of manifests through the body from the original source of pain to various muscle groups and regions that are distant from that original issue as the dog tries to compensate, and how myotherapy just manages that. So that's quite a good little graphic there. Okay, yeah, we've got some more examples. So we've got Rafiki on the left that we've already seen, so that's great because we've got it side by side. And then we've got Princess Fifi in the middle, where she looks like an accordion, where she's just got squidged. And
it's
this
not the same dog. It's not the same dog. It's different dog entirely. She even looks leggier. She looks taller.
Yeah, it's crazy. It's kind of a bittersweet story, actually. These aren't actually dogs that I've treated personally. They're Julia's dogs. But so Fifi was 11 when she came in for treatment, and she was affectionately called Princess Fifi because she was a bit of a diva, didn't want to be hugged, don't touch me. And it was just that. It was like this kind of like personality. And then after 3 treatments, she was actually asking for cuddles, coming up and lying on the owner's lap, and like the owner was obviously overjoyed, but she had that moment of, oh my God, she's been in pain all this time. And that's something we have to support owners through, because learning's painful, right? And they have this guilt, and we need to be there, like scoop them up and say, but you didn't know, you know, that's why we're here. But isn't she so different? Like that's what I mean about the angle between the hip and the thigh bone is a lot more closed in the top picture. Can you see what I mean there?
Yeah, absolutely.
Whereas, yeah, in the bottom picture, the placement of her back feet is a bit further back, as it should be. You know, her neck's got more length, it's a bit higher. You can't really see her face very well, but she just looks unsquished, doesn't she?
Absolutely.
Yeah. And
again,
then
like I said earlier, it doesn't look like the same dog.
Yeah, it's really striking imagery, isn't it? Yeah. And then we've got the the lovely lab on the right, I believe he had a knee issue. So again, not dissimilar in the hind limb posture to Rafiki on the far left. Tails clamped down, we're very straight through the hind limbs. We've got that kind of pelvic angulation that's been changed, which is then going to affect the lower back. Load's been shifted to the forehand. Chronic overloading, which is ultimately affecting the neck. And like the neck is, it just takes so much load in dogs, and you know, they have to hold them up against gravity, and they have to act as like this counterbalance. So there's just so much overloading going through there. Yeah, and you can see the angulation of his hind limbs. He's not quite as straight through the knee and the hock. You've got he's looking a bit more balanced it's not perfect, but he's more balanced in his weight distribution between front and back. Face so much happier, head and neck a bit higher. So yeah,
the difference in all three of those is just astounding. We've got a question here from the lovely Kate, who's a fellow Into member, same as I. She's a fantastic good behaviorist and also a vet physio as well. She said, wonderful talk. Are you allowed to address weight with the Guardian? I'm assuming with the dog, not the Guardian's weight, the dog's weight.
yeah. It's I think it would be remiss of us if we didn't, because it has such a profound impact on their joint health in particular, whether they listen or not. But I think you have to really, because it's just so important. So I will signpost them to resources. It's a real tricky one, because as soon as you get that, or you say that, owners can get quite defensive, or they think it's a reflection of kind of how good they are as an owner. So you obviously have to be sensitive about it, and sort of adapt your approach for each owner. It's tricky, but I think weight is just such a massive influencing factor. You have to.
I imagine that, of course, if you've got a Guardian who is already feeling guilty about not knowing the dog's in pain, then I suppose you have to tread probably extremely carefully at that point, not to kind of exacerbate that guilt, I suppose.
Yeah, definitely. And I think this is the thing. There are so many skills, as I'm sure with your job, that go into it. It's not just about the anatomy and physiology and treating the dog. Like, you have to get really adept at communicating with the client, reading the client. There's so many skills that go into it. So it can be really tricky, or sometimes you can kind of say it, but people don't seem to sort of appreciate the gravity of kind of how things are affecting their dogs. So it can be really tricky.
It's a tough one. Okay.
Yeah.
Oh, bless.
Oh, my friend's dog. Okay, so we're just going to touch on a few indicators of chronic pain. I mean, this is a whole talk in itself, but hopefully by sort of putting these up here, it will just get people thinking. It's not possible to sort of pick out one and go, okay, because my dog's doing this, it means Y. But what you're looking for is to build up a picture of what they're doing. Of course, there can be other causes of these things, but part of the skill of being a therapist is your ability to sort of assimilate the information and interpret it. So gait or movement, I still hear kind of, but they wouldn't run around if they were in pain. So it's a lot more helpful and accurate to kind of look at what a dog chooses to do in quieter environments. So when you haven't got the what do they call it? Reward. It's not reward over pain. You know what I mean, Mark? Don't you?
Yeah, I know what you mean. Yes. The reward they get out of running around, even though it hurts at that moment in time, is more of a reward than not running around.
Yeah, exactly.
They just pay for it later.
Yeah, and Yeah. And you've got the presence of adrenaline, you know, when they're out with their mates running around. It's an exciting environment. We know that high impact activity, such as kind of ball throwing, they become like little adrenaline junkies, literally. So often for us, it's a lot more helpful to look at how do they get up, how do they lay down, what position are they in when they're toileting, how do they choose to rest, do they lick or chew their paws habitually? That can be referred pain. Vibrating or shaking legs, increase in collar size, can be due to the neck becoming overdeveloped, due to it being overloaded to compensate for other areas, reluctance to exercise, but not always, because again, remember adrenaline, they might hesitate to get into the car, they might do like a little run up as opposed to just jumping in with no hesitation like they used to. Sometimes they will rush downstairs because if they don't want to load their hips, which are their brakes, because it's painful, they go, oh my gosh, how am I going to get down these stairs? I'm just going to have to go for it. And I hate those videos where you see dogs like falling downstairs. It's heartbreaking because the dogs are in pain. Less interactive with people or other dogs, more anxious, defensive, clingy, no longer initiating or wanting to play. I know when I have a shoulder pain flare up and I get a migraine, I'm like really depressed and grumpy. I don't want to talk to anyone. So I think we need to start kind of relating it to, well, what would we do if we felt like this? Or when we do feel like this, how does this make me feel? And not kind of dismissing. I think because dogs can't talk, so often pain is either unseen, undetected, or kind of dismissed, and we need to advocate for our dogs. You know, we can take a paracetamol, we need to make those right choices for them. Coat disturbance can be indicative of underlying muscle tension, rolling on a toy on the ground repeatedly. I had a lab I treated, this is one of my Norwegian clients, and he would throw himself down on the ice and rub his shoulders like almost obsessively, and he was so tight over his shoulders, and it dramatically reduced. Excessive stretching, again, it's a bit like us where we're just trying to get some relief. They can push their head into you for a neck rub, or their hips. They can lie against a hard surface where that pressure kind of gives them a bit of a relief. So there's a myriad of signs if we just listen. Okay, let's go to the next one. Yeah, so that there are so many. Let's get these slides on the on your page. All I ask is that people don't download them or share them, because it is copyrighted. Yeah, there's so many there. Yeah, and again, these are all, or the majority of these things aren't necessarily things you would see in a vet clinic. A, because the amount of time is so short that you're not going to see the whole range of behaviours. B, you've got the white coat syndrome where the adrenaline goes up. So this is where kind of all these observations can be so helpful to provide to the vet to help inform their decision making in terms of, do we actually need to adjust the meds, or do we need to try this? Let's go to the next one. Okay, so this is a massive part of what we do as well. We have to tackle aggravating factors to what's going on with the dog, otherwise we're just not going to be anywhere near as effective as we could be. So slippery flooring is a classic culprit. Repeatedly getting on and off furniture. I say to people with their senior dogs, I say it's like your 90-year-old nan with arthritis getting on and off the worktop 20 times a day, and people go, oh, okay. So all of that stuff is really important to address. Inappropriate repetitive exercise, so typically it's your kind of high impact. stuff. However, it can be inappropriate exercise when the puppy was young, not necessarily sort of over exercising, but not having enough of the right type to build that foundational kind of muscle strength, so that the body can work in a balanced way. Undiagnosed, untreated injuries, very often I'll see dogs where they've had a course of sort of metacam, seem to go away, but actually, again, the dog's compensated. Muscles don't sort of, when muscles get tight, they don't release on their own. You need to get in there manually. Conformation, either due to breeding or just that particular dog, can change the sort of loading and stresses on certain joints and structures. Yeah, and then the last sentence is basically what happens kind of in the long term if those issues aren't addressed. Okay, yeah, so we've just got some kind of tips there in regards to home environment. Anyone that doesn't know about CAM, canine arthritis management, it's an incredible resource, not just for dogs with arthritis, but in regards general good management and prevention. There is so much on there about all aspects, kind of home environment, just everything. So go and check that out.
Yeah, it's a great place. I'm one of the advocates for them. It's so much information on there. It's unbelievable.
It is, isn't it? It's so good. Yeah. Yeah, so then we've talked about sort of inappropriate exercise, so your high impact stuff, inappropriate play. So dogs with kind of good social skills generally should kind of adjust to each other and sort of play appropriately. However, you can't sort of bank on that, because not all dogs will do that. We all know dogs that are like, we just want to play, and you're just like, I really don't want to play, can you stop? This is a really important point. Small dogs often, I say walk at our pace, but they're actually trotting, so they're not getting that slow work. So when dogs move slowly, it's a little bit like yoga or Pilates, where they're building that deep muscle strength and foundational sort of postural strength and stability. If they haven't got that, what they will tend to do is recruit the large muscle groups, so they're not then working in a balanced way, which is going to set them up for issues. I love scent work, not only for kind of the physical benefits in terms of building strength, stability, but also as a low impact calming activity. So I'm always advising that. Warm up and warm downs, we can advise owners how to do that. Consider equipment as well. Again, that could be a whole talk in itself, but that's something we advise on. Equipment can drastically alter the biomechanics of your dogs, so that's a really important point to consider. Repetitive movements, promise over pain, that's what I was going to say, but I kind of mixed them up. So what we mean by that is where you've got kind of a reward, excitement, stimulation, that's just going to completely override pain. So do consider that. Observing your dog at rest and noting what they naturally choose to do as opposed to what they're being asked to do is a much more accurate indication of pain. Sorry, slightly jumping all over the place, but this is why we don't use treats in a treatment, because I don't believe a dog is truly consenting if they've got that reward, because it could mean that they're still scared. So I try not to use treats as much as possible. Then you can see what the dog genuinely is comfortable with. Okay, next one. Oh, we're done. Brilliant. Yeah. So you can check out the Galen Myotherapy website. If you do a practitioner search, I'm under West Sussex. I've got like a little mini page on there. If you want to follow Galen Myotherapy, they're on Facebook and Instagram. Likewise, I've got I use my profile as my work page, so you are very welcome to add me on that, or Louisa Grieg Canine Myotherapist is my sort of page, if you like. I'm on Instagram as well. So yeah, you're very, very welcome to message me.
Wonderful. Well, we're going to put these up anyway at that point, and we're left with a cheeky face.
Yeah, a goofy little face.
Well, I mean, that's been absolutely fascinating. I will unshare the screen for a second so I can see you properly again. There you are. Absolutely fascinating. I've learned so much already.
Good.
We literally could have talked for another couple of hours at least.
Yeah.
So we are going to have to get you back.
Absolutely, I'd love to.
Because that was absolutely brilliant. It's been so good to have you.
Thank you.
I can say, fascinating. I'm really, really looking forward to shadowing you at the end of the month
Good.
with your clients. And I'm going to have to get you come out and meet my two thugs.
I would love that. I would love that.
I think certainly that Bear would quite like a massage anyway. I think.
Yeah.
We get on.
Yeah.
Kate said thank you so much. She loved the talk tonight.
Oh, thank you, Kate.
And that's really absolutely brilliant. So I think what we'll do in a second is you and I will say goodbye to Facebook land, and then we'll have a quick chat on our Todd afterwards and just finish it up. But it just leaves me to say thank you so much for the talk.
You're very welcome.
Absolutely fascinating. What a great subject. Hand on heart, I knew nothing about this before this talk. I'd heard of it. I'd seen people that have had them with their dogs. I didn't know anything about it. It's opened my mind completely.
Oh, I'm so glad.
So yeah, I mean, you're already on my list of professionals that I hand out to clients anyway. So that's all good. So another comment here, Biggie or Bigi has said, how long do you train for a certification in Galen myotherapy?
A good question, actually. Okay, so the diploma's changed a lot since I've done it, but the structure of it is such that you have, I believe, 5 modules of home study. Now, the course is designed in a way that people can work it around work, other commitments. So there's no kind of time limit as such. Most people take about 18 months, 2 years. When you sign up to the course, you have to commit to your sort of practical dates, and you need to have done 3 modules by the time you do your practical dates, and then you have case studies. But what I would suggest is, if you are interested in finding out more, go to the Galen Myotherapy website. Have a look on there, because I believe that there's a brochure breaking down the syllabus, kind of everything you need to know. And then if you still have unanswered questions, get in touch with the Galen office. Their number is on there, and then have a chat with one of the tutors, because I'm not on the teaching team, so I'm probably a little bit out of touch with the course. As I say, it's literally a decade since I've done it, but do have a chat with them. They're super friendly. But yeah, as I say, it is designed with kind of other commitments in mind, if that makes sense. So it's a part-time, so you can kind of work it around you. Yeah,
good stuff.
Yeah.
They've said thank you, they're going to do that. So, good luck to you. I hope it goes well. It's a brilliant thing. Dawn has said brilliant talk, thank you so much as well. So I think you've gone down quite well this evening, so people have liked your talk. It's good.
Oh, brilliant.
And like I say, I think we're going to have to get you back maybe in a couple of months' time.
Definitely.
And then maybe if Denise and I feel mad enough, we might do another 12 days of Christmas again. And it depends on how we feel. It's a lot of work.
What was that?
We did 12 days of talks every day. The start of Christmas, and just different subjects. But it was fun. It was a lot of work.
I bet.
Yeah, if Denise is up for it, we might do that again. But anyway, I think it's about time. That wasn't bad going. An hour and a half. That was okay.
Okay.
Got through that, and I knew at one point you were kind of thinking, "Oh, we're only halfway through." But it's all good. So thank you everyone for watching. Thank you for your questions. Thank you for your lovely words for Louisa. Louisa, thank you again for coming on and talking. It has been fascinating, and we are going to get you back. So we're going to say goodnight to Facebook, and we will speak to you again another time.